Right, so we've just gone live, so we just wait for people to come on a second. Because it is 4 o'clock in the UK at the moment. There we are, they're just starting to come on now. So just wait for them to come on a second. Hi everyone, so I did say I was coming back over to the clinic today, so I'm back with the professor who'll give you my amazing tool. So I'm going to let him introduce himself to you, and if you've got any questions at all, hit me up with them and he can answer them all today for you. I have got some that you asked me the other week as well, so I've got all them written down, so if nothing is covered, just pop it into the question box or on the comments and we will pick them up. So over to you, Professor.
Thank you. Hello to everybody. My name is Antanas Mickevičius, a little bit different to pronounce for UK people, but nevertheless I connected with UK for now 12 years and I practice mainly in the weight loss surgery field. I had my fellowship in London in 2010, and since then I was doing jobs here between Lithuania and UK, working around different hospitals until finally pandemic put everything a little bit in different places, and now I have just outpatient clinics in UK monthly, but operating mainly in Lithuania. Nevertheless, we follow NHS standards, we follow EU standards, so we try to be as safe and as experienced as possible.
Well, that's what's sweet, you've been picking you, and I've said this to other people before, but obviously because I'm from the UK, we're used to the NHS, aren't we, and the system that obviously, you know, comes with it, but to know that he works within the NHS, he's registered, it swung out for me, because obviously we're all under the same kind of bracket of like the EU.
Yeah, actually, well, so you can always check my license if you go to GMC page, put my name and surname, it is there. So yeah, and because UK left EU recently, so I don't think major changes in healthcare happened since then. So we probably anyway follow the same rules, the same guidelines and so on.
Yeah, so do you know when you used to do the surgery like on the NHS, is it the same kind of tools, the same kind of system as you do over it in Lithuania? Nothing changes?
Actually, exactly. Procedures are precisely the same, a little bit of a longer process probably of preparation for surgery, obviously, and yeah, so because in NHS we have still long waiting queues, so from one hand side, for some people it is even better just to make their choice, prepare for longer, but some people are doing quicker decisions, and they are happy to go ahead, not waiting for 1 or 2 years before surgery. Always there are kind of patients who are not decided yet, but for them even appointment with bariatric surgeons sometimes gives some certainty. Do they need this kind of surgery or maybe not?
Yeah. So, because over in Newman's we can do they do the video calls as well, so you can always have a consultation. I was just speaking to you now, you're going to the UK?
In the middle of April on the weekend, which is
Looking for a calendar. If not, I can find it and I can pop it in. There's just some things come on you in a second. If I just go through. Oh, hang on, I can turn it. Yeah, I'm so good technical, am I? Right. Just a second. Did see something. There is the man himself, changed my life. Thank you, Professor. 8 stone gone forever. Oh, see, that's lovely.
Thank you. Best wishes from my side, and we're happy to hear and all these things.
Can a hiatus hernia be fixed by itself at the same time as a tummy tuck with Carlos? I think a hiatus hernia would be...
Hiatus hernia, I can fix for sure.
That's not a plastic surgery thing,
yeah,
is
but
it?
I'm not the plastic surgeon.
No.
Tummy tuck is not the same surgery as it is inside.
Yeah.
And tummy tuck, it is just abdominal wall. So it is with the gastric bypass or gastric sleeve weight loss surgery procedures, we always fix hiatus hernia if necessary, but not with the tummy tuck.
Some questions about a tummy tuck, but this is the professor for bariatric surgery,
yeah.
so sorry
Next
about
time.
that one, yeah. But it's about BMI. If you, I can get the details and you can message Paulie about that if you want to know the details for BMIs, for tummy tucks and stuff. Same question about BMI. If there's any other questions about plastics and stuff like that, do you know any of the BMI for plastics, or should I just leave that for Paulie?
Probably it is better to leave. I know BMIs which matter for weight loss surgery, by the way, if necessary.
Yeah, if you want to know the weight loss one. So I wrote the questions down that I had in the inbox. So we'll go straight for this one. What is the difference between a gastric bypass and a gastric sleeve surgery?
First of all, both procedures are nice, and both procedures are very safe. The difference, and actually why there are two, first of all, because if there would be only one, the best, absolutely best, so everybody would do that.
Yeah.
Probably. So both procedures are having their stronger and weaker sides. So if we are talking about gastric sleeve, so this is probably the most popular procedure all around the world in the meantime. Actually, it overcame gastric bypass several years ago.
Oh, the gastric sleeve?
Yeah.
Wow.
But actually, the strong sides of gastric sleeve is simplicity, because it is just cut.
Yeah.
The same continuity of gastrointestinal tract, so the food is going the same way. And it looks a little bit not as tricky on the picture for some patients.
Yeah, if you've had surgery with this absolute genius, he comes with these 2 sheets of paper, and I remember seeing them just so you could see exactly, wasn't it?
Yeah, but anyway, you can also see this on the internet.
On the internet, yeah.
So these are probably strong sides. Also, regarding the vitamins usage, some people do require lifelong supplements with iron after gastric sleeve. Some adopt in few years after surgery, but we cannot predict this. So these are strong sides of gastric sleeve. But weak sides are reflux postoperatively and a little bit a higher probability of weight regain on long run basis.
Yeah.
Looking at the gastric bypass, it is very well investigated procedure, like a Mercedes, old Mercedes, which surgeons are doing this for more than 50 years already. The only difference, it was like an open procedure some 25 years ago.
Oh, you mean like the big...
Yeah.
Wow.
But in the meantime, everybody does in the keyholes way, so
yeah, thankfully.
Don't worry. All right, so this is kind of we know what will happen with these patients. And strong sides also after gastric bypass is a little bit better weight loss and a little bit better resolution of diabetes. on long run basis. There are different scientific studies ongoing still, and we see some differences on 10 plus years after surgery. Yeah. Not on the first year, not on the second, not even on 5-year follow-up, but 10 plus. So there are some statistically significant differences that gastric bypass gives a little bit more of weight loss. And
because that's what you want to look for, really, and not now. You want to be looking in 10, 20 years time of...
Yeah, actually, somebody who decides for weight loss surgery need to think about the surgery as a lifelong procedure, lifelong change.
Isn't it? Yeah.
It is difficult because it is for some young people it is difficult to understand what will happen in some 10, 20, 30 years. But nevertheless.
Yeah. So somebody's just asked, what is the expected weight loss on average of a gastric bypass?
When we calculate weight loss, actually we calculate what will happen in 2-3 years, like long run.
Yeah.
Because I always keep saying to my patients that your weight loss will continue roughly for 1 year, step by step, then you will reach the bottom line, then maybe a couple of kilos up, depending on your new habits, and then plateau happens. So in 2-3 years, you achieve the plateau on permanent basis, and we calculate like not direct weight loss, but excess weight loss.
Yeah.
So the difference between where you are now and ideal weight is the excess body weight. So in gastric bypass case, average reaches 70 to 75% of excess weight loss. So it doesn't matter that you will be even less than ideal weight. Never happens. But 70 to 75 of excess weight loss, it is average. I have to say for younger people who change their habits, let's say increase physical activity, eating habits to more healthy food, you can achieve even better results, because we need to keep in mind we are doing surgeries also for some diabetic patients, a little bit more elderly patients who also influence the average one. Okay, so this is kind of average. If we're speaking about the gastric sleeve, a little bit less, probably 60 to 65% of excess weight loss, but difference is not huge.
No, it's not a lot, but I suppose it's the work you put in after the surgery is
as we've spoken with, it probably depends more on new eating habits, new physical activity habits, rather than surgical procedure itself.
Yeah, I always say you gave me a tool and I utilized my tool. Like 2 years ago, you'd never have got me in the gym. I would never have done anything at all. Like I'd never have done it. Like obviously, I speak for myself now, doesn't it? Like I've lost nearly 14 stone. Obviously, I've had skin removal as well. But the way I am now, I'm so consistent. I'm so determined because I know if I slip as such, then I never want to end up where I was before, like ever. And that's when I got my new eating habits, my new routines, my new everything. So somebody said, Patricia said, do you do sleeve to bypass revisions, please?
The answer in general is yes, of course, but it is a far more complex question. First of all, you need to have an appointment with a surgeon and discuss the reasons of this revisional procedure, because the revisional procedure is always need to have some reasons why the particular patient is not happy with the sleeve.
Yeah.
What are the reasons of that? and if the conversion to gastric bypass is the best choice, because there are plenty of other ways to fix the issues. If it is just weight regain, sometimes medications or appointment with dietitians and some changes in the diet matter. Obviously, if there is a gastroesophageal reflux, acid coming up, so then before decision we need to have scope test down, just to realize what's going inside. It is not the straightforward way, because it is, you cannot operate like
straight away. Yeah, I get that.
So, but in general, obviously, yes, and it is much helpful sometimes.
It's just another tool in the box to help you get to your end destination. So a lady said, I've stalled majorly. How can I kickstart? I've had a sleeve and I'm down 14 stone from 21 stone, but I still want to lose another 3 stone. So what would you suggest?
I would suggest an appointment with surgeon to discuss her personal details, because it is probably not the case to discuss all together.
I suppose every single person's different, and like somebody said you do gastric sleeve. Yeah, you just got that one.
Actually, I'm doing all the bariatric procedures, which are also not only gastric sleeve, also sassy and all.
What's sassy? What's that?
Single anastomosis, stomach to intestine.
I've never heard of that.
So
God, what is that?
Well, it is not very popular. It is a little bit more popular in Eastern countries like India and so on.
What is it? Is it like...
it is when you do a sleeve, an additional kind of junction between stomach and intestine to achieve additional hypoabsorption of calories. Some food is going directly into jejunum, some food is going in a normal way.
Is that like a mini gastric bypass?
No,
is that similar?
A little bit of similarities, but a little bit of difference. I'm doing mini gastric bypass as well, if necessary.
There we are. So that's good to know. There's more options, but I come to the decision if I was having a gastric sleeve after speaking to the professor and after having all my tests and stuff like that. That was what was right for me. I suppose having that consultation is the most important, isn't it? Like, click it. I just want a gastric bypass. Why do you want a gastric bypass? Would a sleeve be better? Would something else be better for you? Isn't it? I think having that consultation is key.
I want to also to mention that we always do mandatory pre-op tests, including upper GI endoscopy. Look for particular gullet, stomach from inside, and I see patients after all investigations are done, and we discuss everything in details, and I suggest my option of ideal procedure for them.
Right. Is it normal nearly 2 years post-bypass to be eating larger portions of food? I am still within my calorie maintenance, but I'm scared I'm eating too much. But I wouldn't know on a gastric bypass. Obviously, I know with my sleeve, I'm able to eat more now than I was at the start because I was eating such minimal amount, but I still don't eat a lot. I still eat small portions more often.
Honestly, it is also difficult to predict. There are some possible reasons why portions do increase, but in most cases, actually, we need additional investigations to detect what kind of reasons are causing this. First choice is actually just to, as the lady does in the right way, just try to follow the new eating habits, not to increase these portions. If she struggles with that, then probably, and the weight regain starts step by step, probably not necessarily to wait up until weight regain happens.
Maybe contact the team.
But contact the team and discuss what kind of investigations could detect the reason, what's going on inside.
So a lady said, also for the lady that asked about excess weight, I lost 100% of my excess weight in 12 months post-surgery date. That's amazing.
So we're happy about this result.
Yeah. Is it normal to still struggle to eat normal food 6 months post-gastric sleeve?
What does it mean, struggle to eat normal food? We always advise and suggest that you need to develop new eating habits. Eat slowly, chew very properly, and so these are new habits. If you still struggle with that, of course you will never be the same person. You will never be able to eat on the way some burger in 2 minutes. And so if that so this is a different story. If you really struggle and some kind of dysphagia in there, food digs in and so on, so maybe some additional investigations like barium swallow or endoscopy could be helpful, just to see if there is no like rest of inflammation after procedure or so on or so on. Anyway, so you probably can contact somebody, email the team, and some appointment online when we can at least discuss details of these struggles.
Consultations, key, isn't it? It's the key to everything.
Communication is the key, always.
Always. Like if you're struggling, there's always someone you can reach out to, isn't there? A lady said, I was sleeved in October and I still only eat 6 tablespoons, mainly protein. Would this be about right? Again, I found that we all can eat so many different amounts, can't you? But 6 months post-op would be November, December, January, February. 5 months post-op?
Should be more like more space for different types of food. But on this particular occasion, probably she needs to speak with dietitian initially.
Yeah.
How to introduce more products like
into the diet. Yeah, because
so
protein is key, isn't it? Protein is key, but also veggies are. Fiber is like
step by step, but dietitian advice would be necessary in this. If maybe she's just scary.
Yeah, it is scary though. I do remember when I had my surgery and they came the next day with a pot of yogurt, and because I had surgery with my best friend, and I looked at it and I was like, oh my god, it was probably like a yogurt about this size. And I can remember the nurse said to me, don't eat it all, and my eyes nearly fell out my head. I said, how the hell am I going to eat all that anyway? Like 1 or 2 mouthfuls down, I was like, oh, I can't eat anymore. And I don't know whether it was like my tummy telling me, because obviously it was so new, or my mind, like, and I just couldn't get past that. And I'm still the same now. I still only eat off a side plate. If my food come on a big plate, I still feel intimidated by it and I wouldn't be able to eat it.
Well, so this is the thing, actually. There are probably 3 parts: the stomach, eyes, and brain.
And mine, I definitely feel like that. Right, so there's another question you got for you. What is the criteria for a bikini line gastric sleeve?
Well, it is kind of gastric sleeve can be done through the bikini line, actually, because it is a little bit more cosmetic.
Yeah.
Because
so you don't get the scars up there.
Yeah. So actually, there is one keyhole which we put scope through umbilicus, which is nearly invisible, and the rest of those are through bikini line. In reality, we do the same procedure inside. The only difference is the hole's position.
Yeah, it's completely hidden.
So, but for some who are very tall, like above 170 centimeters, I do apologize. I'm acting in centimeters.
He doesn't know the conversions.
Yeah, so 170 centimeters.
About 5 foot something, isn't it?
Yeah. So and who has BMI above 50, it is already compromised, because it is already about safety. Yeah. Because we acting through the longer distance. You know? So these are also previous open surgeries matter, especially in upper part of abdomen. So for the rest of people, we can discuss bikini line sleeve.
It's nice to know it's an option for people, isn't it?
Yeah.
A lady said, is constipation very common with weight loss surgery? I do see a lot of people struggle with constipation. Is there a reason?
Again, because initial period, most of them, especially after gastric sleeve, because continuity is the same.
Yeah.
So can struggle because you eat smaller amount of food.
Yeah.
Your body is not adapted yet, and constipation, especially in first post-op months, happen. Well, but it is just temporary. Later on, your body is keen to adapt. After bypass, it is not so common because we do more
Rerouted inside, is
yeah,
that? Yeah.
more straight way
Yeah.
from the mouth to the tail.
From the tail.
Actually, because we're bypassing some part of the stomach and some part of small intestine, so
Yeah.
it is more direct way. So constipations are not as common. So we influence not only the stomach size but also absorption from the intestine.
So with the absorption, is that what causes constipation in people further out?
At some stage.
At some stage, because I do see, like, and there's a couple of people I speak to and they do struggle with constipation, and they are like, you know, coming up to their year post-op and they're still struggling. Like, they drink their fluids. Like, obviously fluids is really important because that's like what gets the bowel going, isn't it? But obviously, again, probably say head to your team, would you?
Yeah, so also can have like a consultation with your GP or some medications can be prescribed because
it's a lot of fiber and stuff like that.
Even without having weight loss surgery, plenty of people are struggling with
constipation. They do.
So
so Rachel says slider foods are no good, and I need to get out of this hole. Another lady said, I have a pacemaker. My cardio team agreed I could have a sleeve. I'm 16 months post-op. I'd like my stomach flat. Is it possible I have a pacemaker? I think that's probably. I'd say there's probably a point where you'd have to have a consultation with you, wouldn't you?
Yeah, exactly.
Too much. Don't want to get into too much on there with him. Oh, not a question. I just want to say hi and thank you to Professor. 22 months post bikini sleeve op, and I'm 6 stone down, and my life has been completely changed.
Okay.
And do you know this amazing lady? This is another lady who I connected to on Facebook. And when we was talking about it, she's from Lithuania.
I see. So
Yeah.
Look, so what a nice community.
It is. It really is.
I'm so happy to see I did some good job for some people, you know.
Fantastic job, excuse me, over here. But yeah, this lady, I connected with her on Facebook and we were speaking, and she said like how highly recommended you was as well when I was doing my research. And I think she was at the time maybe month, 6 weeks post-op, and we'd spoken, and chatted, and I'd had my consultation and stuff like that. But yeah, this was the lady that was kind of made my decision easier for where I was heading, because obviously I had like that point of contact that someone had been here, had the surgery, and she's from Lithuania as well. Fine. So that was lovely.
Good to hear.
So that's nice, isn't it?
Wishes, yeah.
Is it normal after a bypass for your stomach to make a lot of noise, especially after drinking?
Well, yeah. So this is what we see sometimes, because you've got it is different kind of thing which we cannot predict. But I've heard from few people that noises
they do make a noise,
are, especially in initial period. Later on, in 1-2 year time, the body adapts to all things which we are doing with the body, so it is likely noises to settle.
Yeah.
But on initial period, sometimes intestines still confused a little bit inside.
They do make the funny noise. You eat sometime and it's like, or it sounds like a dinosaur sometimes. That's in the early days. I'd lie there and the children would go, Mum, is that your belly? I'm like, yeah, it is. I don't know what it's doing. Like, I don't know what it wants. Like,
well, but at least it is not painful and not dangerous.
No, it's not. No pain. It's just like a funny noise. I don't know, maybe you've answered this. What are the main medical indications for revisional surgery?
Medical indications, there are no medical indications, mainly like if you have a severe gastroesophageal reflux after sleep, which sometimes causes so Barrett's esophagus, which is pre-malignant situation. So then we definitely need to speak about revision to gastric bypass, which actually is able to sort out the reflux issues. Otherwise, well, weight regains wise, it is
that's I think that's
flexible,
the
medical indications or not indications. So again,
because you can gain weight, can't you? Because I see a lot of this is spoken about like within the weight loss community. Because like there is a massive community out there which you don't know about because you're not into the social media, but there's a lot of out there, and they say more people gain their weight back from a sleeve and then they go for a gastric bypass, but you can still gain weight, can't you, from a gastric bypass if you no longer follow the rules, isn't it?
Exactly. So every single procedure, whichever is that, can fail.
Yeah.
As we discussed, surgeon does his job in, let's say, in 2 hours, later maybe 2 days when patient is in hospital time.
Yeah.
Rest of the life, patient does.
The patient does the job. So do you know if like you've gained so much weight back, like, and I know you said this earlier on, that before gaining a lot of weight back, you need to speak to a dietitian, you need to come back to your team. But do you know if these people that don't come back and they've gained weight off their gastric bypass, is there another avenue after having a gastric bypass? Because obviously once you've had a sleeve, you could have a bypass. So once you've had a bypass and you've gained the weight or you feel like there's nothing else, is there another avenue then?
There are another procedures like a duodenal switch or distalization of gastric bypass, but these are again, it is not like you get one iPhone, and
that's
you
what I was
change
trying to
to
explain.
and another like iPhone 10, 11, 13, and so on. No, it is your body. We do not have possibility to reconstruct everything. We need to look for the reasons. And if there are psychological reasons, we need to stop at some stage, saying, sorry guys, we've done what we could, but we cannot change your mind, we cannot change your brain, and surgery is not to influence your quality of life in a worst way. Like we all expect better result, not a worse result. Because if you repeat surgeries, finally you will.
There's only so far you can go, is there, I suppose? Because I know I picked the sleeve because the sleeve was right for me, but then I know some people pick the bypass first because they don't want to fail at the sleeve and they think the bypass it's easier to have one surgery than 2 surgeries. That's a lot said in the weight loss community.
Yeah, so sort of things in kind of shape of mind, but again, so honestly, if there is properly done gastric bypass and it failed without any sort of gastrogastric fistulas and so on, which are very rare. If it failed because of not nice eating habits and physical activity habits, well, from my personal practice, before doing revisional surgery, I keep saying to my patients, this is the last time I will operate on you.
Yeah, it's good that there's a cut-off in it. You can't keep just doing medical when...
Yeah, so...
It's psychological, isn't it? Like, I never drank alcohol for a whole year. I done the whole year with 0 alcohol because the rates of transfer addiction and stuff like that was... kind of like, not scared me into it, but I thought if I could go along, if I could do 6 months, I'll do 6 months. So there went 6 months when I thought, let's go for the year, and I did it. And I'm not really much of a big drinker anymore because I never wanted to go down that route.
You see, but it is again, and some support from environment, from community, from from relatives and your family much matter in this particular field. So, or with weight regain and so on and so on. If somebody is not supported, it is a little bit higher probability
for that. And that's, that speaks true as well, because I've got such good support from my husband, my children, my parents, my family, and I think having that support there, same as when I've just had plastic surgery, the support that I've had, well, it's been incredible. Hi both, thank you for doing this. What, if any, would be a clear sign of post-operative complications that may occur after the 2-night stay in the clinic?
Well, of course, this is kind of most important 2 days directly after surgery. But, this is surgery, and no one can predict for 100% that there will be no further complications. So in general, we ask people to stay for additional 2-3 days in here close to the clinic, in apartment, in a hotel, and we provide some information like dysphagia, high fever, pain, severe pain, other things which we need to follow for next few days also while back at home. Different things can matter. I can't tell all these things, but the most dangerous complications, which are bleeding or leak, happen in 2 days' time in absolute majority cases when you are staying in the hospital and we keep an eye on you. These complications needs for immediate action. So this is why we keep in hospital for 2 nights. Actually, some people feel quite nicely even after 24 hours being in hospital, and they say, okay, so maybe we can stay another night at the hotel, but just for the safety.
I was quite happy with the 2 days in hospital, because I told you I was in agony after my gastric sleeve, but my plastics was a different ball game. Remember when you couldn't see me? I was like, I have no pain. I've got no pain. So should the patient need a consultation before surgery? You've already covered that, haven't you? And he's going to be in the UK next month. So if anyone wanted any...
Actually, well, first of all, we ask to fill the form.
Yeah.
To fill the form, which can be done online. And we look at the individual criteria. If everything is nice and clear, sometimes we just email, first of all. But if there are comorbidities and if there are previous surgeries, please feel free to contact by email, and we will arrange the at least online consultation. If necessary, like a live personal appointment, I'm in UK every single month for a weekend, and
poor bugger's not going to have an holiday now. He'll be doing all these consultations in London.
No worries.
Right, how to prepare for surgery? What pre-op tests need to be done? So I think you've kind of covered that once, didn't you?
Right, so in most cases we have a package at our clinic, and we do all these pre-op tests like blood tests, ACG, mandatory upper gastrointestinal endoscopy tests, endocrinologist consultation, and dietitian plan just before procedure. So these are most common. Also, like appointment with psychologist if necessary, we apply all of
that. So this is a biggie, because obviously I'm suffering at the moment, but would you recommend taking out the gallbladder at the same time of having bariatric surgery?
Well, so again, it depends on the preoperative findings. We are not keen to take a normal gallbladder. Case.
I said that to someone before. Like, I didn't have any gallstones 2 years ago, so I still got mine.
If there are stones, known stones in the gallbladder, and more than that, if these are causing some issues, episodes of colic pain, we discuss this possibility to take the gallbladder at the same time when weight loss surgery happens. But again, it is kind of point and area for discussion, because additional surgical procedure also involves additional risks.
Yeah.
Like, for example, you can have nice result of gastric sleeve or gastric bypass, but you can develop bile leak after,
From having the gastric.
from
The
having gallbladder
gallbladder.
removal, right? Again, this is very safe procedure, but nobody can guarantee.
You can't, look into the future, can you?
You understand what I mean? So
Yeah,
that
yeah.
Kind of doubles risk
Yeah,
of
because it's two
post-op
surgeries
complications.
really, isn't it? Yeah,
exactly.
two
So
surgeries.
you act on the stomach, you act on the gallbladder.
Yeah.
So this is kind of thing. But if there are stones, not silent stones like we say, but causing some issues,
Yeah.
this should be discussed before surgery.
So is the recovery after having a gallbladder and the bariatric surgery, is that a little bit longer?
No, because
recovery?
actually, anyway, you follow strict diet after
Yeah.
weight loss surgery, so nearly the same advices we provide after gallbladder removal, like avoid fatty food,
Yeah.
avoid spicy food, eat smaller portions to give some space to your liver to adapt with bile supply. But after weight loss procedure, you anyway.
Yeah, you haven't really got much option, have you? How do you know if you're dumping? Do you like the dumping syndrome?
Well, somebody who dumpings, he knows.
Yeah,
he
I was
has
going to
it.
say, for me personally, I've dumped off a protein shake in the early days, and I remember I drank it too fast, and I remember drinking it, and all of a sudden, like, my cheeks were going red, and then I was yawning, and then I felt like nausea, and I had like the foamies, and I knew then I dumped. But the other times that I've dumped, now if I dump, I fall asleep.
Yeah, well, so
I instantly fall
this is kind
asleep.
of you can see these symptoms on the internet as
Yeah.
well. So it is like a weakness, sweating, and you need just to. Sometimes nausea, obviously nobody vomits, but after gastric bypass, but still some sort of issues with, and you just need to lie down and lie for some half an hour. It settles.
Yeah.
But it is very unpleasant. It is not life-threatening situation, but it is very unpleasant. And then you need to look for the reasons. What caused this? So you probably need to exclude this or follow another way of consuming this thing.
Yeah.
Because in most cases it happens once you are too quick,
That was exactly it.
or too fatty food, or too many carbohydrates, sweets, and so on.
And
So-
that's what causes the dumping, doesn't it? It's a horrible feeling. Once you've dumped, you know when you're dumping. Because, let's just say, the last time I had it, I think I'd done a naughty thing. I dipped my biscuit in my cup of tea and I ate it at the same time, which I shouldn't eat and drink, and I don't. It's not a rule of thumb.
So it's just like policemen inside of you.
Yeah, and then all of a sudden my body was like, oh, well, go bed now. It's your own fault. You've dumped now. And then
But the funny thing is you cannot predict
No.
before surgery if the patient will be dumping or not. But anyway.
So do you just said then, so do you know people with a gastric bypass, can they not be sick?
Well, because it is too small amount of
I didn't
inside
know
your
that.
pouch, so you can vomit just from your pouch,
Yeah.
small pouch, not from the rest of your
Well, the rest
intestine.
you can, so once it's gone through your pouch and it's gone in your
Yeah,
intestines, it's
no,
gone.
It's gone.
Well, I never knew
You do
that.
not have motoric function in your bowel to throw back.
So like with the stomach, it can like contract and come back, but with it,
but not intestine.
wow. Well, yeah, I didn't know that. What is the post-operative care?
Well, actually, the post-op care also is very important. So in here at Newman Clinic, we provide kind of 1 year follow-up. When you seeing surgeon and dietitian in one 6 and 12 months time. It can be online consultation, or if some issues are serious, you can see me in personal. And also in a discharge letter, we give some advices to your GP regarding blood tests, which we suggest in 6 months time and 12 months time. We actually ask the appointment with dietitian and with me while having already test results, so we can correct and give some advices regarding vitamins which need and supplements which needs to be used, maybe some corrections and so on. So these are things which we provide. At 12 months time, it is like a last conversation, and we also can provide some advices regarding plastic surgery at that stage.
Yeah. So do you know, like vitamins, when you just said that, is there a specific brand that you would advocate for, or is there ones that you could avoid, or what's your perception on vitamins?
Well, actually, with our advice, we're working a few years already with vitamins which are developed for this particular community of patients after weight loss surgery. These are called Baricol, and we're happy because there are different kinds like chewable, fluid form, also tablets. So it is wide range of things which patient can use on daily basis, whichever are more suitable for them.
But they are very important to take your vitamins, aren't they?
So
very important.
You need to take vitamins.
Can hair loss be avoided post-op?
Well,
that's a hard
one. Yeah, first of all, you need to take vitamins. So this is absolutely mandatory. The second thing is there are some additional details like medications for external use, which a little bit helpful. But the third thing is you need to follow dietitian advices strictly. If you play with too fast weight loss, it happens, and unfortunately when that starts, it is difficult to stop in few days. The good message is that once your weight stabilizes, hairs come back.
It does start to come back then, yeah, it does. I lost loads of hair.
But probably the main message is just to follow suggestions regarding eating habits strictly and take vitamins regularly. Do not forget.
So that is your main ones for them.
Yeah,
I've just seen another lady. Again, what is best for hair loss? Can you stretch your stomach after a sleeve? I've heard that you can, and I've heard that you can't. Or would weight gain be due to eating the wrong foods?
Well, so yes, you can stretch, not during first year, not during second, but if you see.
So how would you stretch your stomach pouch then? Would it be overeating?
Yes,
pushing yourself, regularly
overeating, and in some 5+ years, it can happen.
Could you stretch your bypass pouch as well?
Well, in general, the answer is yes. You can stretch even small bowel, which is attached to your pouch of after gastric bypass. I saw these cases. The small bowel becomes like a stomach, but it depends. If you go to a gym like for bodybuilding, you will never be huge in half-year time. No,
you won't. It's a long process.
So it is training. Yeah. Unfortunately, the same training gives result with your stomach.
Yeah.
If you do wrong things for a long time, I
suppose it goes back to going back into that, like the way you think, don't you? If you're going to continue to sort of overeat, you are going to stretch. But if you can't stretch a gastric bypass and you can't stretch the sleeve, they're both, it's how you work your tool, isn't it? What about fizzy drinks then? What do fizzy drinks?
I always ask to avoid fizzy drinks because these are things which can cause pain.
Yeah.
Because there is no space, right? And
Does that cause stretching?
well,
Does it?
In general, yes.
Yeah.
I always say to avoid beer after gastric sleeve.
What about drinking with a straw? Because somebody messaged me that the other day, and I didn't drink with a straw at the start, but I found that obviously because I couldn't gulp, I always used to gulp before I had my sleeve. I'd have a straw, and I'd keep the juice in my mouth, and then I'd take it down. I'd stop like taking the air down. But what is the thing to with using a straw after bariatric surgery?
Well, it's I don't think it is very, very.
Because some people say if you have a straw, that's gonna take so much air in, or that is gonna cause problems. But I suppose if you're struggling to get fluids in.
No, I think it is. It doesn't matter a lot. It is more anyway. Whoever is drinking, swallowing, you do this as controlling all these things. So it is. If you drink fizzy drinks, so something happens inside.
Yeah.
And here you can control all these things in your mouth. So, unlikely it is very, very, unless you swallow without control.
Too much, you swallow too much. Thank you. I'm not worried. I was just wondering because I've heard both, so that's nice. Can you have a revision surgery to a sleeve of an existing gastric band that's caused scarring?
Well,
so what is
it is again like a revision.
Is it hard to go from a gastric band to a sleeve or a bypass? Because there's a lot of.
It is a revisional procedure, but again, I go into the same thing. First of all, you need to have scope test down because bands sometimes are keen to erode into a stomach. So then it is far more tricky to take the band off and do the another procedure at the same time.
Yeah.
It can be 2 steps procedure, but in most cases, if OGD is normal, we do not see changes from inside, so then it can be done at the same time, like a conversion to a gastric sleeve or gastric bypass. I always leave some space for decision for me, because sometimes even from inside, having all these tests done, it is difficult to see what sort of scars the band caused, and if you just go blindly onto a sleeve necessarily, you can have a severe reflux after surgery. Honestly, we convert a little bit
I suppose
more often to bypass from the band, because most of the patients with the band are already having issues with lower esophageal valve and suffer with reflux.
So do you know, once you've had like a revision then, obviously like from band to sleeve to bypass, does that cause slower weight loss then?
Yeah.
It does it?
It does, and body has memories. Body has memories how to fight against starving already, because most people already lost some weight with a band.
Yeah.
So body has memories. A little bit more slow weight loss, but it will definitely happen.
So it'll happen, but it could just take that
a
little bit longer.
Oh,
that's mad how your body remembers that, isn't it?
So it is very clever.
It is clever, isn't it? I did wonder that, because there's a couple of people that I speak to, and there's this one lady, I won't like to say her name, but she had a band to sleeve last June, and she's getting herself a bit upset. Like, the weight is not coming off as fast as the person who had it the same day, but I suppose if there's a revision side of it, like you've just said, your body's got memory, so hers is going to take that little bit. Well, that's good to know if you've got a band and you want to come it out. There's the other wizard by here. Right, what type of diet is suitable after a bariatric surgery?
Well, so it is more the question to dietitian, but in general, it is more healthy food, high protein, vegetables, avoiding of carbohydrates and fatty food. So this is like in very, very short manner.
Yeah.
Otherwise, you can always seek for appointment with dietitian. And these guys, they are keen to explain everything in details.
I know, when I got discharged, I had a big massive pack of what I could eat and like the stages of how to eat as well, which obviously I felt like I was a baby. Do you know, like when you're a baby, you start off like with the liquids, then on to the next stage, and then on to the next stage. And again, I felt like I learnt how to eat again.
Well, but
yeah, and whilst making new, what's the word? New habits. I've made all new habits, and I felt like as a baby, I've learned to eat again the right way. I had a sleeve already in the UK, but I got to say, if I was considering weight loss, I would have no reservations about coming to Newman. Thank you for offering so much advice to the community, and thanks, Dan. Oh, that's lovely.
Good to hear again.
Yeah, that's lovely. So we've got 2 more questions, unless anyone else have got any other questions. When is the right time to return to your daily routine, work, etc.?
Well, so it depends again. Stomach-wise, all these sutures inside are not going to erupt.
Yeah.
It is more about tummy itself. But so in general, if you have like an office job, we say, okay, in 2 to 3 weeks time, if you have a physical activity at your workplace, so then maybe 4 to 6 weeks. But it is very individual, I have to say. Some people, they just jump after surgeries, and you can see them outside walking somewhere in 2-3 days. Some are a little bit more in pain, and it is...
That was me, Me and my best friend had at the same time. She was like walking and doing what have you. I was laid on the bed still sucking Calpol for 2 weeks because I couldn't take a tablet. But again, it's all completely different.
Yeah.
Some people can sail it and some people can't. Like my plastics was completely different to my bariatric surgery. Check your DM. Okay, I'll have a look at my DM after. A lady said, I've had a sleeve, but my reflux is so bad I will need to have a bypass.
Well, so it depends again, but you need OGD first.
Yeah, a camera down. So say if somebody booked now to come over to have revision, just saying, and they come over and you've done all the tests, is there anything that would stop them having a revision? Is there anything, like obviously if they're saying I've got this now, is there something that would stop it?
Well, so...
Or is it
there are things which actually, there are things, if, for example, if you have an ulcer inside your stomach, which is high risk for bleeding, because surgery itself, it is additional stress for your body, and suddenly if the ulcer start bleed after surgery, we do not want this.
No.
So it is better to delay, treat the ulcer with medications, for example, like in 1 month or 2 months time, we will have safe surgery with a healed ulcer.
Yeah.
And the other thing, well, I do not say it is a common thing, but again, like a lesion or something like that, which we check for, let's say, while doing gastroscopy. It can be the same thing for revisional surgery or primary surgery.
Yeah.
When we're doing scope test down, if there will be some sort of thing which we...
It done it with my mum. My mum had surgery with this absolute wizard as well last February, so she's 13 months post-op, and my mum came over to have a gastric sleeve, and when she had all her pre-op tests, again, she did have no idea, nothing whatsoever, and she had polyps, I think they were called, inside her stomach, so she took them away, done all testing and stuff like that on them for her, and that was, say the Tuesday. On the Friday they come back that everything was fine, and then she stayed an extra couple of days, and you done the surgery for my mum.
Yeah, we did.
But she would never have known.
Yeah, we did biopsies. Histology came back as totally benign. So then we were on the safe side, and we proceeded with surgery.
Yeah, but like my mum's a nurse, and my mum said like the care that she had, and like you made sure that she felt safe and stuff with her. She was blown away from her. But yeah, I always say like if she didn't come here for a gastric sleeve, then what could my polyps have gone to? I always say that it kind of saved my life and my mum's as well. Right, the last question, unless I've missed any. This lady said, this is really putting my mind at rest. My daughter only emailed the clinic last night regarding surgery, and I'm worried about it.